Hi, my name is Marianne Wamboldt. I'm a child psychiatrist, and I've long been interested in how relationships between parents or caregivers and their children can either help ameliorate some of the illnesses that children have, both medical and psychological, or who can exacerbate those illnesses and make them more difficult to treat and more difficult to get under control. So my colleagues and I have worked for about 10 years in defining specific criteria for a parent-child relationship problem. And those criteria include both dissatisfaction from either the parent or the child or from a third party, say a therapist who thinks that there's a problem with their relationship, as well as problems in at least 2 of 3 categories. So behavioral problems, such things as poor conflict resolution or avoidance or inadequate supervision. Affective problems, things that when the child thinks about the relationship or the parent thinks about that relationship, there's sadness or apathy or anger. And cognitive problems. So if the child does something bad, the parent might think that this is a pervasive problem and something inherent in the child, as opposed to thinking they made a mistake and they're an inherently good child. Or conversely, if the parent does something good, the child might think that this is an exception, that it's just by accident and it's not who the parent really is. So we're really looking at distortions in all 3 of those areas of functioning, either affective, behavioral, or cognitive. We set up a set of criteria and we tested it on 133 parent-child dyads. All the children were receiving active psychiatric treatment at a large children's hospital. And we had 2 separate clinicians interview the parent and the child within a 2-week period. And each clinician was blinded to what the other clinician rated or thought. But each clinician was given a report from the parent, a self-narrative about how the parent thinks and feels about their child. And they were also given some structured instruments that the child filled out, both the parent bonding instrument and the perceived criticism measure. Clinicians rated these criteria based on whatever kind of interview they wanted to do with the parent and child. And we found that overall in this symptomatic sample, about 34% of children and their parents had a diagnosable parent-child relationship problem, which was actually much lower than what the clinicians in our clinic thought it would be. They had anticipated about 3/4 of our families meeting that criteria. That could be an artifact of these clinicians only knowing the patient and child and parent for a brief interview and not knowing them over a period of time. Importantly, though, the clinicians did have fairly good interrater reliability. So it was in the good range, which is as good or better than many of the diagnoses that were also tested at our site for the DSM-5 field trial of pediatric mental health problems. So hopefully you'll enjoy reading the article about the specific criteria and how we went about rating it. We also have qualitative comments from many of the clinicians as to what they thought were the strengths and weaknesses of the diagnostic system that we proposed. And I'd appreciate hearing feedback if you have suggestions on how to improve it. Thanks.